Hi everybody, it's Tracy from Downward Dog Rising, and I'm going to give you a workout tonight for hips in case your hips feel super tight like mine do. And so we'll do yoga mixed with Pilates for tight hips, for flexibility, for being able to move hips, mobility, and also for a lumbar spine stability. So if you have issues with your low back and your hips are tight, well then stick around. All right, let's start. We're gonna start off, I'm gonna teach you how to make sure your hips are aligned side by side. And there's a little exercise in Pilates we do called pelvic clock. You think of the numbers on the face of a clock, and then your navel is 12, pubic bone is 6, and then your left and your right hip bones in the front of the pelvis, I gotta think about this, the left one would be number 3, the right one would be number 9, yeah, wait, 3, 9, 10, 11, 12, yeah, I had to look at the face of a clock in my head. So your two hip bones alignment would be 3 and 9, and it's not uncommon if one hip goes like into 4 or maybe 10 on one side, and that means your hip hikes. And guess what happens? If your hip hikes, then a lot of times your quadratus lumbar muscle in the low back is also getting pulled tighter, so it creates discomfort. All right, so if that sounds like anything that could apply to you, this would be great to have you join me. Let's start. First, lie down on your back. Your feet are going to be hip distance apart. And then we don't want the knees to fall outward. Shoulders in alignment with hip bones. It's called anterior superior iliac spine. These two bones right there. Middle and knees are going to go right over second toes. And you're just going to align everything. Okay, so first I'll teach you pelvic clock. 12 o'clock is your navel. 6 o'clock is pubic bone. I want you to draw your abdominals. Here's my hand. I'm pulling in with my core, and then I'm releasing. So I'm going to go exhale, draw in, inhale, release. And then what I do, I streamline my abdominals into my spine. I pull them in vertically, like along the length of the spine, and then I let the pelvis release again. So here's spinal flexion. And then if you have herniated disc, just watch your ranges of motion so you don't cause pain any direction. Basically, just stay out of pain. So we're going to go 12 o'clock, 6 o'clock. Really try to access your abdominal wall, drawing it into your spine, because I want you to feel the spinal muscles on the opposite side release. Exhale, inhale. 2 more. Exhale, inhale. Again, if there's pain, you just stop your range of motion that causes it. Simple. In that respect, you just stop what you're doing if there's pain. Okay, your 2 hip bones straight across. So I like to think of starting navel, drawing straight across. That'll get transversus abdominis to wake up, to turn on like a belt, horizontal. Then if you could keep half your pelvis down on your mat, so let's just say that the right hip, 9 o'clock, is down. You would take the left hip straight up, kind of like a seesaw. Right hip stays down, left hip goes up. Go to an inch or 2 to left side of navel. Pull those muscles in to get your hip back down. Exhale. Inhale, lift. Exhale, lower. Lower, if I could talk. Pull the hip down. Inhale up. Exhale, bring it down. 4. Ideally, you try to keep your legs pretty still. 3. Allowing the pelvis to move. 2 more. Come back center. This will help with belly dancing if you plan to go belly dancing, or if you plan to do like a cha-cha dance. 1, 2, 3, 1, 2, 3. This will help you move your hips. You're going to go right hip up, and then down. I can already tell my movement quality is different. So you want to feel like you can make room. So now you're going into your, actually right hip's 9 o'clock, left hip was 3 o'clock. I inversed it. Sometimes I do that. I say the opposite of what it is. I don't mean that. That's the right side would be 9 o'clock. The left side's 3 o'clock. So you're going to open the space between the ribs and the hips. If my fingers and thumbs move closer together, that could be a sign of hip hiking. Up and down. Up, down. My hips and my thighs want to move together on this one, so I'm trying to be careful. 4, 3, 2, last one. Okay, now really think of length between ribcage, hip bones. Press all 4 corners of your feet into the mat. And I just felt gripping in left hamstring, so left glutes shut off. Try to engage both glutes. Stretch your tailbone away from your breastbone. So tailbone long. And then like a bridge, hinging up, hinging down. Hips come down, same moment. Go up, straight down. And then your abdominals tighten into your back. Up, straight down. 7 and 6. Spine is long. 5. Try to create some space across here. Shoulders, chest. Collarbones wide, shoulders out of ears. 4. 3 more. Draw those core muscles in, hips to sky, glutes are engaged. 2 more. And last one. And then a test to see if your glutes are both turned on or not. Take one leg in the air, wide across chest, shoulders, lift, lower. 7, 6, this will get that left hip in line with right, left glute working. 5, 4, really tighten quarter spine. 3, 2, fold that knee. Now, tailbone long. This part of the back stays elongated so you don't arch. Tailbone long. Other leg up. Keep hips aligned. Down. Elevate. Now feel your right glute turn on. 6, 5, 4. Keep the hips straight. 3. To the sky. 2. Last one. Bring leg down, and again, lower hips straight back to mat. All right. Now, if your ribs pop up like that, that's called rib popping. We don't want that. Bring the front of the ribs down together in front. Pull down together. Okay, now your middle back's on the mat. Now your middle back is supported. That's what we want. Okay, so take your left knee to the side. Keep hip bones straight up and avoid moving either hip. So you're just going to move your left leg sideways. 7 more. Narrow the 2 hip points together in front. 6 more. And 5. And 4. 3 more. Hips are straight to sky. 2 more. Last one. Think of the 2 hip points coming together. Now avoid letting your pelvis rock or roll. Keep the other hip straight to sky. 7. I want you to really engage your core to keep your pelvis stabilized into the mat. 6. 5. 4. 3. Really concentrate. 2 more. Last one. All right. Turn to one side. And I'm going to have you prop up on your elbow. Be careful of collapsing where everything scrunches together and there's no space. We want to avoid that. So pull shoulders away from ears. Think of your bottom ribs lifting. Your collarbones open and wide across shoulders, chest. So now what I want you to do, you're going to squeeze your heels together. We're going to do something called clam. And then you wouldn't do this if you have low back symptoms, because sometimes it can make it worse, so be careful. Hip bone aligned with hip bone. Careful you're not going like that, moving the hips. Knee comes down. Now I want you to really squeeze the side of your hip. Lift, down and up. And 8, 7, keep hips stable, 6, 5, really stabilize, 4, 3, 2, squeeze side of hip and thigh. Okay, next one, try it with your heels lifted into the air, up, careful not to collapse like I just was, it's easy to do. Inhale, exhale, keep pelvis stabilized. 7 and 6, I'm targeting my core, I'm pulling directly into the spine. 4, okay, that's giving me a little burn. 3, 2, all right. Okay, next, take your bottom leg out straight, hug top knee in, collarbones wide. Take your ankle down to the floor in front of you. And then what I want you to do here, collarbones wide, point your foot, come down and flex. You're gonna lift and point, come down and flex. Here, I'll move a little more. Point to lift, flex. Point and flex. Point and flex. 8, 7, stretch, lengthen your inner thigh adductor. 6, point and flex, and 5, 4, point and flex. 3, 2. If the pointing and flexing is too much for you or it's irritating for you to do, just relax your foot. That's fine too. We're going to do another set. 10, 9, 8, 7. Your whole body stays stable. 6, 5, keep space open between ribs and hips. 4, and 3, and 2. Good, last one. Swing your top leg back, press your hip points forward, and then think tailbone long, and just do a little stretch for the hip flexor, so as breathing in, breathing out. And if this hurts your shoulder, if your shoulder is sore right now, you would just come all the way down on the mat and use your arm, bottom arm, as a cradling your head like a pillow. So if it ever bothers your shoulder, you would cradle your head like that and then just keep your alignment so your neck stays long, shoulder out of ear. I'm going to do it the same way that I did it on the other side, but if you want, come on down. Okay, make sure you don't collapse. Create space in your body. Bottom ribs lift up. Shoulders out of ears. Collarbones wide. Chest is open. Okay, let's do clam. Heels pull together. Think of those 2 hip points really in alignment. Space between rib cage, hip bones. We don't want a hip hike. The knee goes down. This is your clam. And the knee goes up. The knee comes down. The knee comes up. I just saw my wrist buckle. We never buckle our wrists. Keep them neutral. Energy travels. And it could affect your shoulders and your shoulder blades and your back. So I'm going to just take my arm up to here so I don't buckle my wrist. Hips are stable. Good. Engage side of hip and glute. Tighten your abdominals in. 5, 4, 3. This is for your low back lumbar stability. 2, by keeping pelvis stable, you're going to also stabilize your spine. Good. Last one. Okay, for a challenge, lift the heels up. Same thing. Rotate. Keep collarbones wide in front. Rotate without moving pelvis. Keep space along sides of neck also. 8, squeeze the side of that hip and thigh. 7, heels are lifted. 6, you'll feel this one a little more if your feet are up off mat. 5, 4, scoop your core deep into your spine. 3 and 2. All right, pull under the knee, draw it in for a moment. Okay, we're gonna gently just take that leg back, stretch it out. If this bothers your shoulder, come all the way to the floor while you're doing this. Hip points, hip bones press forward. Tailbone stretches long, that way you don't hyper arch your back. You want to hyperextend, over arch, tailbone long. Inhale, exhale, you'll feel your collarbone widen across shoulder, chest, sides and neck are long. Breathing in, breathing out. Breathing in, breathing out. One more. Feel that deep stretch straight down. Inhale, exhale. Bring heel to back of thigh or glute. Next, take your top foot, plant it down on the mat. Okay, now, I might slide out a little more. You're going to keep lengthening your adductor group. So we have, let's see, how many adductors? Adductor magnus, adductor brevis, adductor longus, gracilis, sartorius. Do I remember each and every one? Let's see. One of them is really long and inserts way down, and then you have some more that are shorter. All right, point and flex. We're gonna point, and again, if it's annoying to point and flex, avoid it. Just kind of relax your foot then. Inhale, exhale, point, flex. Shoulders out of ears. Point, flex. I forgot pectineus and gracilis. Inhale, muscles. Inhale, exhale, inhale, exhale. And 5, 4, 3, 2, last one. Okay, 10 more. So we're gonna do 2 sets. Point and flex. Keep stable. Point, flex. Point and flex. And 8, 7, 6. I'm noticing my left glute is tender, touching the mat. Ooh. 5. Woo! 4. Not a little tender, a lot. 3, 2, and come in. Good job. Okay, so now what I'm going to have you do, we just went over each side of the hips. We're going to go onto our back, and they're going to do a little figure 4, a little reclined pigeon. Cross left ankle over the right knee. Take both hands under the bottom thigh. Use your elbow to press that thigh away from you to try to get a deeper stretch. Getting into those lateral hip rotators. Stay here and breathe. Let's flex our feet. That really helps the hips and the knees. Okay, and if you wanted to go deeper, you could always grab your shin. It's a different type of stretch. It goes a little deeper, feels a little different. If that helps you go deeper, do that. Grab your shin. I'm going to grab the back of my thigh because I can get better lateral rotation with my elbow touching the thigh when I do it this way. Flex your feet. Inhale, exhale, flex the feet. Letting your hips release. Feel like the back of the pelvis is sinking into the mat underneath you. Spine is long. And try to let your shoulders relax into the mat. Okay, we're going to take one more deep inhale. Release. Inhale into the middle of your back, between your shoulder blades. Exhale, release. One more. Breathing in. Exhale, release. Reset. So you're going to take your right ankle, cross over that left knee, lift up, flex your feet, and again, reach through that space. Hands wrap under the thigh, and then you're just going to press that thigh away, a little higher than knee. Keep your back long into mat. Notice where you feel it on the other side, might be a little different. Spine is long. Again, if you want to have a slightly different stretch, pull the shin in. Ooh, that goes right into the gluteal. Deep into the glute. Less lateral, more in the center. This one I can feel it more laterally, outer edge of the glute when I press into that inner thigh. Stay here and breathe. You are tight wherever you're tight at, so if you feel a stretch different than where I feel it, that's totally okay, because you're having a different experience than I am. That's totally okay. You're tight or you're tight, and I'm tight or I'm tight. Breathing in and breathing out. Just unwinding a bit. If you're always on the go and cranking up your body and your muscles, it'll be happier taking the time to do this. One more deep inhale. And gently release. All right. Okay, next thing. Gently rock side to side across the low back, as long as that's okay on your back. And we're going to turn to one side now. We're going to turn over to our side. Your legs are going to stretch long. Shoulders down and back. Space between ribs and hips. I want you to press top hand in the mat. Keep shoulders out of ears. And you're just going to stretch legs long and come in. Now, make sure that this hip bone doesn't roll behind you and make your body break into two halves. That's not what we want to do. Keep a long line, shoulders, hips, knees, ankles, chest open, armpit to palm, lift, down, lift, down. Careful not to break in the center there. Lift and down, 7, down and 6, and 5. Stretch legs long. 4 more. Abdominals draw into your spine. 3 more. Create some space in lumbar vertebra. 2 more. And last one. All right. Now, we're going to prop up on our forearm again. Now this time, take your heels a little bit forward in front of your 2 hip bones. So instead of being in a straight line, heels just come tiny bit forward in front of the hips. And then I'm just going to have you bring hand behind head, create open spaciousness across my things bothering me around my neck. There we go. We're just going to take our hand behind our head, lift those ribs, point your toes. Again, I'm doing that toe point thing. If it bothers you, just relax your foot. The whole goal, point. Now, engage side of hip and thigh. Flex on the way down. 7. Think of wrapping those ribs together in front. And 6. Slow with control. 5. 4. Keep the length in your spine. 3. Really get into the side of your hip and thigh. 2 more. All right. Okay, let's reverse. Okay, point, lift up, come in. Careful not to collapse. Chest is open. Inhale. Exhale. 6. 5. Keep those hips stacked one over the other. 4. And 3. 2 more. Good, last one. Head away from tailbone. Take a moment. Roll onto your back. Same leg that you just worked. We're going to take opposite leg straight onto our mat. The leg you just worked, lift it up. Go to the outside pinky toe side of your foot. Your shin's going to be parallel, knee in line with ankle. You're going to start to pull that knee towards the floor. So we're going to do a little single happy baby. Ardha Ananda Balasana. You're just going to let that knee sink down towards the floor. Hip opener, going a little deeper into your hip. Spine is long, head lengthens away from your tailbone. Breathing in, breathing out. Breathing in, breathing out. And one more time, breathing in, breathing out. Gently extend. All right, arms overhead. You're gonna turn to your side, press up. Go ahead and swing legs to the other side of your body. And we're gonna go flat on our side. Remember, we don't wanna roll our top hip back. We have to keep our alignment. I'm gonna extend the legs. On this one, we want our legs to extend out straight. The reason being, we don't want to break our body in two halves. We want to keep our alignment. So make sure this top hip doesn't roll back behind you. We're going to lie flat. Think ribs out of hips. 3 o'clock, 9 o'clock. Left hips, 3 o'clock. Right hips, 9. Careful not to hike or hunch up in your shoulder joint. Collarbones open wide across the chest. Try to get your ribs to stack too, so your ribs don't start twisting. Armpit to palm. Now gently, you're going to lift both legs up into the air. Keep the length without losing that straight line. 180 degrees, straight line. 9, 8, we're making sure that top hip doesn't rotate backwards. 7, keep the spine long. We want to create some space for the low back vertebra. 6. Inhale, exhale, scoop your abdominals tight to your back. 5 and 4. Stretch and reach. 3 more. Abdominals scoop in. 2 more. Really scoop the abdominal wall in. Last one. Excellent. All right. So now prop up on your forearm. Again, we got to be careful. We create spaciousness through our body. Spaciousness across collarbones. Spaciousness from tailbone to top of head. We pull our blades straight down our back to the back of our hips. And then we're going to swing our heels out a little bit forward. So instead of a straight line, just bring those heels out a little baby bit. Keep the hips aligned. Make sure you don't do what I did. That's collapsing. I collapsed the whole right side of my body into the shoulder. My ribs collapsed. I have a little scoliosis, so my spine twists to the right. So I just collapsed into the right side of my body. So we have to have awareness and move slowly, precisely, with precision, and have concise motion so we can catch ourselves when we do stuff like that, because it's common to lose your alignment. You have to pay attention. So we're going to point as my knee pops and cracks. Things pop and crack too when your alignment, when you get it aligned, it'll move things around. Breathing in. Exhale. Wrap those ribs. Bend, lengthen, extend, and down. And 7. Cracking through the ankle. First it was the knee, then the ankle. Goes right down the chain. And 6. Squeeze the side of that hip and thigh. Give it some support. 5. 4. Abdominals are working this whole entire time. 3. Hips are stable. It's going to protect your low back. 2. Breathing in, breathing out. Last one. Okay, then we're going to reverse. There's always a side that burns more. Ribs up. Heel flexes. Point, extend. Heel flexes. Keep neck long. Those bottom ribs have to keep wrapping around. Keep wrapping. 8. Point, wrap. 7. And 6. Point. Avoid collapsing. 5. 4 more. 3 more. My leg feels like lead. 2 more. Woo. Last one. I ran yesterday and today. Okay. Now, roll onto your back. I wish I could run every day. I just can't fit it in because I go to trails. I gotta drive to the trail, drive back, go get a shower. So it's a big production, but I do it every chance I get. So you're gonna extend one leg long, reach the outside of your pinky toe. Now, your shin, your ankle, knee, you're gonna line it off. Start to pull that knee down towards the floor. Deep stretch in the front of your hip, thigh. And then on the other side, it's a hip opener as well. You even feel it into the side of your hip and glute. And that piriformis even. If our piriformis gets super tight, it can kind of fall or collapse. And if it does that, it can sometimes hit your sciatic nerve. And that's when you can get that radiating pain down the leg. It's not the only reason. It's just one of many. Breathing in, breathing out. Start doing half a happy baby. Two more inhales here. And one more. All right, stand up. Gently, we're just gonna breathe into the space mid-back between those blades. Release through that thoracic spine. Extend your legs up for 3. Bring them in, and 2. Bring them in, last one. Okay, we're gonna bend both, reach the outside edges. Let your knees drop towards the floor. That low back just lengthens down into your mat. Release the neck if you feel any tightness in the neck. Draw those knees towards the floor. Breathing in, head away from tailbone. Now think of the 2 hip bones, 3 o'clock, 9 o'clock, tightening, narrowing all the way across and together. So you have support in those lower abdominals. You'll feel some tone in the abdominals. Like they dome 3-dimensionally through the body into the front of the spine. Then you're going to feel the back of the pelvis widen into the mat below you. Take a few breaths here, and it should feel like the whole low back lumbar area, back pelvis widens into the mat below you. As my stomach gurgles, getting a huge gurgle noise. Breathing in, breathing out. Breathing in, breathing out. Inhale. Exhale. Widening across back of hips and pelvis. One more time. Inhale and exhale. Excellent. Gently extend those legs. Now I'm going to have you do something called hip opener in Pilates. That was a hip opener in yoga, doing the Anatolia. Now a hip opener in Pilates would just be doing something called knee circles. Knees circle apart, knees come back in as you tighten your core to your spine. 2 more. Last one. Kind of let the femur bones fall back into your hip sockets, your acetabulum. Come the other way. Like guide. The hands are on the knees. I want you to guide your legs. Let the legs go. Let your arms do more of the work. It totally will change the exercise. So feel that. Totally changes it. Guide. Hold on to those legs. Couple more the other way. Pull your abdominal wall through to the front of the spine. One more. So your arms are going to do more of the work to really give stability and security to the legs as they go deeper into the hip socket. So we just reversed. Last one. Scoop core in. All right. Okay, so I'm going to go into the middle of your back for a second. So let's go ahead and turn over. Just going to turn our entire bodies over for a moment. I'm just doing an angle change. I'm having a bad hair day, so don't mind me. Frizz out mess today, so I don't care, so don't mind it. Now, your hip bones face straight down into the mat, and basically, I want you to feel like your elbows, you could prop yourself up on your elbows, the tops of your feet are going to rest into the mat, and again, careful that you don't like let your shoulders hike. Okay, I'm going to hike up. It's really uncomfortable right now, and if you feel that in your own body, you'll know exactly what I mean. What I want you to do, push down into the elbows and the palms and the forearms, and then feel as if you're being suspended straight across the middle of your back, like everything just widens apart. See if you can feel that. Collarbones wide in front, and then you're gonna feel space between the front of the bottom of your ribs and the two hip bones. And if you get at the right spot, your abdominals start to tone in all by themselves. Like you don't have to suck your gut in, your abdominal wall doesn't have to get pulled. You're just kind of in the right anatomical position, giving some support, giving a little space. And it's almost like you're going to feel the abdominals dome into the spine, like doming into the front of your spine. Tilt your chin tiny bit forward. What I'll say about that, avoid making little wrinkles on the back of your neck. Like if it feels as if you're going to make little wrinkles of your skin coming together on the back of the neck, that means you're bringing it back too far. So you want to keep the chin tucking, not tucking, just slightly forward and down. If you could see my chin. So instead of coming up here and making my neck shorter, I'm going to come down here, make a little bit more room, and just hang. You might be feeling your arms working across the middle of your back, those triceps even. Mine are starting to shake, I just noticed. Okay. So we're just going to do another little stretch before we close out. So this is a, I don't know if I say it right. Okay. Sphinx. That's it. Sphinx. I try to put an F sound instead of a P. Sphinx. So now we're going to go 90-degree angle with the right arm to the right of our shoulder. It's going to come down into the mat. We're going to peel that left leg up. We're going to keep the left hand directly under the left shoulder. And we're just going to rotate and just open the hips up a little bit. And then let's just stretch the side of our neck, our shoulder big time. Getting into our pectoral muscles in our chest, anterior deltoid. And the hip again. Breathing in, breathing out. Now, if this was too intense on your shoulder, then come back out of it. Maybe just do this where you just have one leg bent and one arm in 90-degree angle, just for a little stretch, but just not as much. Breathing in, breathing out. Good, breathing in. Now my toes are cramping. Oh my gosh. Okay. That's funny. My hamstring cramped earlier. Okay. Gently come back center. Breathing in, breathing out. Okay, we're going to do this on the other side. Elbow, 90-degree angle. This other hand under the right shoulder. You're going to have the left shoulder pressing down into the mat. And then all you do, you're going to pick up that foot, press your palm directly under right shoulder, and twist and breathe. Oh boy, I'm going to get a cramp in my right hamstring now. My ribs underneath me on the mat are super tight. Breathing in, breathing out. I know it's my spinal twist goes right, and now I'm pulling down into those left ribs. That's why. Think of your collarbones widening, your blades anchoring down back, shoulders out of ears. Press from the right armpit into your right palm to give a little more stability and support to your shoulder. Breathing in, breathing out. Breathing in, breathing out. You might feel a stretch through the front of this hip, back into the back there. Across here, a little back. Breathe into those ribs. Really expand the ribs. One more deep inhale here. And then slowly come back center. Okay. Gently shake out your hips for a second. And then we're just going to let our body settle for a couple seconds. Maybe you'll have one hand rest on top of the other hand. Take your forehead. Slowly nod nose side to side. Cross that third eye. Ajna. Come back to the center. Slowly take your hands under your shoulders. And we're just going to do a couple. Just slowly hover. Elbows hug in. Hover to strengthen your upper back. Come up just a little baby bit. Hover. Come back down. Hover. So I'm not taking you into your low back, doing extension for low back. I'm just keeping you into the thoracic spine, in between those two shoulder blades, in case you ever flare your ribs. It'll do you some good to strengthen in the middle back there, in between those two shoulder blades. Breathing in, breathing out. So you don't want to go so high that those ribs lift off the mat underneath you. They're still touching those floating ribs at the bottom. They're not going to come up off the mat. Breathing in, breathing out. We're just going to do two more. We just want to give some little bit of a challenge. Core tightens into spine. And the last one. I'm going to get into that middle part of your back. All right. Go ahead and let your elbows pull straight back. Now you're just going to press straight up to your hands and your knees. And I'm just going to have you do a little cat-cow, stretching out your entire spine. If you want the tops of your feet, I'm going to see if I can keep my feet flat. I always curl my toes under to protect my knee, but I don't feel my knee tonight, so I'm going to try it this way. Exhale. Inhale. Lengthen head away from tailbone. I want you to spread your shoulder blades apart. Dome abdominal wall anteriorly to the front of the spine. Sounds weird when I say that, but I'm acting anterior. I know your spine is in the back of your body, but we have the front of our spine and the back of the spine. I want you to actually think about your abdominal wall pulling through the body into the front of your spine. And then as you stretch apart, just open up the back of the spine. Two more. Exhale. Inhale. Last one. Exhale. Scoop in. Inhale. And let's just take it back into our rest pose, Balasana. I'm not sure if I could keep on the tops of my feet or not. I'll find out. Sit back, hips over heels. Maybe for a little bit I'll stay. Nope, I'm coming up. So if you're like me and your knees are super sensitive, you might have to curl your toes like I just did. And just slowly relax your forehead into the mat. Feel like you can stretch the sits bones, bones you sit on, backwards behind you towards your heels. Feel widening through the back of the ribs, the back of the pelvis, space lengthening apart between ribs and hips in the back. Pull your breastbone like you're elongating it through the two arms. Pull forward. Stretch your spine apart for a sec. Couple deep inhales here. Inhaling into back and sides of rib cage. Relax shoulders, head, neck. Even feel a stretch under the armpits. Let's do one more deep inhale. All right, slowly walk your hands in. Gently, you're gonna start to lift up your upper body. All right, we're gonna turn and we're just gonna face forward, cross the knees, ankles, and then just see how you feel. I am so sleepy, but that's good. This should help me fall asleep. Just feel like you're rooting down. You're rooting down into the earth, feeling grounded, feeling centered. We want to line up our chakras, those swirling energy vortexes in our body. Like, mimic the universe, actually. Kind of like space and time. Out in the galaxy. We also have swirls of energy rotating around. Points. All right. Take a deep inhale. Stretch all the way up through top of head. Exhale as you bring palms together at your heart, centered. Feeling relaxed, feeling peaceful, calm, yet rejuvenated. So I appreciate you all for joining me in my workout this evening, whether it's morning, afternoon, or day where you're at. And thanks for joining. If you like my content, please kindly hit like, share, subscribe, and that will greatly help me with the YouTube algorithm and with growing my channel. I'd appreciate it. So thank you. The light within me honors and acknowledges the light within you. Peace, everybody. Stay safe. Later. Take care. Bye. See you soon. Bye.